I want to bring in Dr. Matthew Heinz. He is a hospital physician and former HHS official during the Obama administration. Dr. Heinz, welcome. Great to have you with us. So we are nearing the grim number of 200,000 deaths and 7 million cases. As our David Begnaud reports, 20 states are trending toward more cases. So do you see this as the beginning of a second wave, or did we never really get out of the first?
I think that certainly in Arizona, where I practice, we really did see a pretty we had an initial wave and then kind of a pause as we started to do some interventions, and then we opened up the state, and then a huge surge that we saw back in June. End of May and June, which lasted into July, and we're just kind of recovering from that now here. But in other parts of the country, I think that we could be getting close to looking at that fall-winter wave that could correspond with the flu season as well, which is what most medical experts are really worried about.
It's so difficult looking at the U.S. as a whole because, there's such a varied climate here and there's so many different areas experiencing different COVID realities. But one respected model does predict that 400,000 U.S. deaths are possible by the end of the year. Can we prevent that, Doctor?
Absolutely. We have had the tools to prevent this for really since the onset, and that is, I know we've heard it a lot, but wearing masks. That is staying 6 feet away from folks, social distancing, as we've heard discussed, avoiding congregating in places, especially where folks could be eating and drinking, making loud noises, which happens when folks become intoxicated. So, minimize bars, restaurants. Probably a good idea to stay away from arenas and all these things. We've known that for a long time. And actually, the what you referred to, I believe, was the middle prediction, if I'm not mistaken. I think there was that was like the right. Middle of the road prediction. Worst case scenario was over 6.
That's if we keep going kind of along the lines that we're doing right now. There was a much worse case scenario prediction, exactly, Doctor, which a lot of people think we might be in danger of getting close to because not everybody is following all of those guidelines that you just said that we should be following.
That's right, and we have we really need for mask wearing to work, which it really does stop the virus. I mean, it just can't get from human to human without the water vapor that we exhale and that others near us can breathe in. That is truly the only way that coronavirus, or the way that coronavirus mostly gets from person to person. A very small percentage can, of course, travel by contaminated surface, but most of it through that water vapor. 95% of people or more wear it's going to be very effective, and we need to take it seriously.
But Doctor, there is also some national confusion because, for instance, on Friday, we saw the CDC revise its guideline on who should get tested. The agency was under fire for earlier saying that those who came into contact with a COVID-19 patient didn't necessarily need to be tested, but then they basically backtracked saying those people did in fact need a test. Then HHS said it would follow the revised plan. So at the end of the day, people are confused because it starts to feel political. Have you ever seen a tug of war over public health policy like this?
Never. And when I was serving in the Obama administration under Secretary Sebelius, this was not how things worked. The Secretary's office, while of course the Secretary has the authority to oversee every section of HHS, but you don't countermand the CDC and second guess what they're doing and rewrite recommendations to be politically expedient and then put them on the website. I suspect that maybe not, the CDC may not even known that that was happening. So you have what I believe to be political appointees who very likely don't have any scientific background or not much. They know just enough to be dangerous, basically. Those folks are trying to manipulate things and make things look better for this administration. And all we need is scientists. We need the scientists, the public health experts, and we need those folks to be they need to be elevated and listened to. And to be very clear for all of your viewers and listeners, if you have come into contact with someone who is known to have COVID-19 for less than 6 feet apart, for at least 15 minutes or more, you absolutely need to get tested. This is whether or not you have symptoms. That is the guidance. That should never be changed. I just want it to be really clear.
Right. Thank you for clarifying that for us, Doctor, because, from nearly the beginning of this pandemic, we have seen a split between the White House and the medical community, with a few exceptions. First, Dr. Fauci was the focal point, but in recent weeks, we've seen the president openly contradict Dr. Redfield. So, to be clear, who should people listen to here?
Well, I think one of the most important things is to listen to their own local county public health departments and their county public health officials. There are many versions of the CDC all throughout the country, at the state level and at every county level. And those folks are closest, they're on the ground, they're in your community. They will have the best and latest, most up-to-date information about exactly how the pandemic is spreading or not in your area, and that's the most important. I'd say that's the most important place you can get information. And we're going to have to let the CDC hopefully political kind of pressure soon, but we have to kind of just monitor that guidance very carefully. But pay attention to those local officials and also to state officials in some cases, because they know what's going on the ground.
Very great point. Local medical guidance, very important for everyone to check in with their, local and state officials. Dr. Matthew Heinz, thank you so much for joining us.
My pleasure. Thank you.